So, hi, my name is Raphael. We are here to talk about the gender dysphoria, and I have the immensely pleasure to invite Miss Susan and Mr. Marcus Evans. They both have a lot of things to tell you about the gender dysphoria, especially right now in Brazil or in Spain. They have a talk for so much people around the world, but now we're gonna talk with them, especially about the book. This book is very important for you to understand more what's going on in the world, especially with kids. Welcome, Mr. Susan and Mr. Evans.
Thanks for having us.
Yeah. When we last time spoke, I wasn't aware about the full picture, about everything, about the Tavistock Institute, the Carabel's case, and many others case. And for that, I bought your book and then I started to read and research, and I was research for another doctors and psychologists like Lisa Macchiato, and also there is the ladies who have the podcast, Miss Omei, Sasha. Sorry, I have the name of
and Sasha Ayed.
Yes. I when I go to the gym, I am listening them. I don't listen music. I'm always in the podcast about that, because it is very important for me to explain what's going on in the world for Brazilians and the Spanish people. And for that, we can start with you. Who are you both, please?
Who want to start?
So I'm Susan Evans. I used to work at the Tavistock GIDS, the clinic there with the children. Only 2003 to 2007, between those years, very part-time role, but I'm a psychoanalytic psychotherapist. When I worked there, I was a clinical nurse specialist, but essentially I worked there with the intention that I was going to work psychologically, exploring and supporting the children who felt distressed about their gender identity.
And then you're going to say...
Well, no, you just introduced yourself.
So I'm Marcus Evans. I'm a psychoanalyst and have worked in psychiatry and at the Tavistock. I worked in psychiatry for 40 years, at Tavistock for 20 years. But what I was known for is thinking about personality disorders and people with psychotic states. I'm interested in the overlap between psychoanalysis and psychiatry.
Oh, thank you. You can help me also with the question that you explain. I don't have too much experience in interviewing in English, and please help me. So, what's going on in the Tavistock? We have a lot of things about the Tavistock. Tavistock is not a gender institute, but that is the Tavistock. That is a past, a very important past. But why people is talk so much about the Tavistock, especially in the Carabel's case, which we're gonna dive in later. But what's happened, especially with you two?
So basically, just to say what the Tavistock is our national psychotherapy training institution. So it doesn't have beds and inpatient units, but it has a lot of individual rooms in which people do family therapy or individual psychotherapy. And that's its purpose. But it's got this, used to be a small unit when Sue worked there. She can talk a bit about that, in the early 2000s, which was called the Gender Identity Development Service.
Yeah, it used to be. So when Dr. Domenico Di Celio first set it up, he's a psychiatrist who worked at the Tavistock, and he set it up originally in the late 1990s, I think it was. But when I went to work there, it was a tiny unit, really, very few people had come across this issue, and we took referrals from all over the United Kingdom, and probably we got between about 80 to 100 a year. So that was from everywhere, all over the UK. So it was a very rare thing. To me, it was fascinating to go and work there. And what I thought we would do is the same there as the rest of the Tavistock, because we have in the Tavistock a thing, you might hear this expression, talking therapies. But the Tavistock was not involved in providing medications for patients or, as Marcus says, the inpatient service. There was nothing like that. But people would come there to think psychologically about their lives and work with therapists who would help them address any issues that they were having. So that was the sort of model. And it was a very, for me, a good model. I mean, and we've both worked in mental health services all our lives, but it seemed to be a really important point and a part of people feeling better about their lives and their mental state and so on. So that was it. But what happened was that after a few months there, I happened to notice that a child that had been presented to the clinicians, this very small team, only about 7 or 8 of us, I think, with quite a few complex difficulties. There were sort of issues in his background, which one was used to hearing when you work with adolescent kids in mental health services. But also he had gender dysphoria. And the clinician who assessed him came back only a matter of months later. He was 16 and said she was going to refer him for hormone blockers. And I felt quite shocked by that because so I asked her, how many times have you seen him? And she said 4. So for me, when you work in any kind of area of mental health, but particularly with children and adolescents, you're only just beginning to get to know a patient. The relationship hasn't developed. They wouldn't be necessarily trusting their issues to you in a full sense. So, it was just shocking to me that you could, in 4 sessions, make an assessment. Okay, this child is going to now be medicalized and put on a path of medical chemical treatment rather than a psychological one in the first instance.
So you said just 4 times the girl was there to talk with the professionals. For you, you was very concerned about that. But what people asking me if why kids feel like that? If you don't understand, please let me know. Why kids feel because it's an self-diagnostic.
Yes. Well, there's been a development. I mean, we can both talk about that, but just to say, obviously people hopefully now are aware that something that used to be extremely uncommon is now very, very common. The numbers have exploded. So a year or so ago, I think there were over 3,000 referrals to the gender identity service. So it's really exploded. And I think there's quite a few reasons for that. We talk a bit about this in our book, but we're not really sociologists. I
understand that.
You have ideas. Do you want to say a bit about them?
Well, the thing is, I mean, just to answer your question, I mean, obviously, one of the things that's become apparent, there used to be an old cohort, which was mainly small numbers of males transitioning to females, and post-18. And then there's been this huge explosion of females transitioning to males at sort of puberty. Now, one of the things that goes on, isn't it, is that there's this process we all go through as we move from being a child to being an adult. It's got all sorts of psychological, sociological, and physiological implications. So at puberty, you develop secondary sex characteristics. It introduces a change in your body. You're becoming a mature adult who can take part in sexual reproduction. That's got all sorts of implications. and heralds, in a way, the fact that childhood's coming to an end and adulthood is going to take place, with all of the demands that that puts on you. Now, one of the things that we found is that a lot of these kids are quite fragile. They're struggling with their identity. They don't really know who they are in many ways.
Do you think it is something of it overemphasizing, like overemphasizing their feelings, or I don't know? Because it is normal for us. I was kids once. I was a teenager. I have a lot of conflicts. Do you think it's a overemphasize of this kind of feelings and pathologizing them?
Well, yeah, I think that is a problem, that in a way that what's seen as a sort of mental health problem is now expanded into all sorts of areas which we would previously consider ordinary parts of human experience. So that, yeah, adolescence is a confusing time. You're confused about what's going on with your body. You're confused about whether you're a child or an adult. And what we found is that many of these kids, then they feel that they can't manage the confusion, the anxieties and pressures that come with this transition. They're not sitting on a sort of a psychological structure that is able to tolerate the sort of turbulence that comes with adolescence.
And I think just to sort of, I mean, as I say, we're not sociologists, but just to sort of answer that question about, why has this exploded so much? I think it is complex. The generation of kids now have had a very different experience of childhood. There is much more material online. They learn online. Many of their relationships are via the internet, and they talk to people via a computer. So I think that there's been that change. And I think also we don't yet know how much the change of parents who are on their phones but with their kids in the park, how much that's affected the relationships, that the kids, ability to relate to people and socialize maybe has been impacted. I mean, there's not been sufficient research on this as yet, as far as I'm aware. But I think when you have kids who've had that different experience, I think society has also, unfortunately, in its attempt to perhaps be kinder to kids, we don't want to go back 80 years when kids were beaten in school and beaten by their parents, but there's been such a shift that I think my experience is that many parents now feel they've got to be their child's friend, that their child shouldn't experience any conflict or the word no when they're growing up. So maybe they don't develop as many social skills to cope with the difficulties that lie in the things that Marcus is describing, how to get on when kids tease you at school, how to come to terms with your sexuality. And it's just a very different world they've grown up in. Add to that, obviously one can't ignore that there has been a sort of more of an ideological activism, really. There's been a lot of a push on the internet around this issue. And that is always up for debate. The people who sort of promote the idea that there are indeed all these thousands of transgender kids feel that they were just kept in the dark. They were too ashamed to admit it, or, and that now everyone knows about it, we can all come out. There are other people who feel it's a kind of cult or a kind of religious zealousness around it, and that you get pulled in because you feel at odds with the world, or you feel you don't belong, and suddenly you find this group that you identify with, you feel taken in, and so that can be very comforting to suddenly feel you've got a group of friends who say you're fine as you are, you're beautiful, you're strong, you're brave. So that's very seductive for a kid who feels lost and alone and doesn't fit in. And of course we'll probably come on to detransitioning, but the difficulty is we're now beginning to see worldwide is that, for a minority of those patients, perhaps a transition is going to be something that feels good for them in adult life. What we're also now seeing is a lot of young, really early 20s kids are coming and saying, this was a terrible mistake, and why was I led to believe that this would sort my life out? So, yeah.
I talk with a mother of a 3 years old kid. It's a child, it's a baby for me. And I was very concerned about what she said to me. Look, she said, Rafa, my name is Rafa. How can I allow my kids? He's a boy. It's a boy. He was born a boy. But she is convinced for a doctors in Brazil, the kids is a girl because the boy behaved like a girl. And she said, how can I allow my boy grow up as a boy if, let me reformulate this.
Yeah. How can she allow her son, if he behaves in a feminine way?
Yeah. And
see, the whole thing is based on a narrow preoccupation, this thing called gender. But first of all, you've got a kid. You're relating to a kid. Now, how the kid expresses themselves and what they identify with, well, that's going to change over time. Sometimes you identify with the more traditionally masculine pursuits. You might go work with dad on the car. Other times you're helping mum make a cake. Now, these are rather stereotyped divisions in a way. They're but kids identify with their parents. That's part of growing up. But it's an unfolding process as you move between different identities and you're finding your way. It's a story that will unfold. But in a way, what this preoccupation with gender does, it sort of narrow, as if life is all to do with your gender, which is a social construct anyway, rather than, first of all, we're people. We've got our own identities and we should be supported in developing our own identities as we move through various phases. The problem is with this preoccupation with gender, everything gets narrowed down as if the secret to life is something called your gender. But behind that, there's all sorts of issues about how we are as people, how we deal with the struggles that we all have with the world, with ourselves. That's often the kid wants to narrow something down. These kids have got complicated problems. They may be on the autistic spectrum, or they get anxious, or they're anxiously attached. And everything gets narrowed down as if they say they've got one problem with one solution. Now, that's what people do when they're under pressure. They narrow their preoccupations. The mental health professional's job is to broaden things out. Say, okay, that's what you're thinking at the moment, but let's think about who you are, what you're struggling with in the broadest sense. You're good at maths, you're part of the football team, have you got any friends? How do you get on with mum and dad? You're going in the opposite direction because we know that we're complicated. We have all sorts of moving parts, and we're trying to understand the whole picture. What this narrow preoccupation with gender, which is part of this, it's a symptom of a problem, not the solution to complexities of life.
As you said before, but I want to ask again: is it a good idea to transition of 80 years old kids to opposite sex through chemical treatments? Do you think is a good idea?
Did you say over 18 or under 18 then? I didn't.
Under 18.
Okay. So
Exactly. In Brazil, we have now a case of 80 years old kids. Now is made a fully transition for the opposite sex. Was a girl who wants to be a boy.
Yes.
Now they are promoting them especially in Brazil. There is a hospital, the Hospital das Clínicas in São Paulo. Do you want to say?
Yes. So I suppose that here we come to Kira Bell's case and people like her who you've mentioned, because for listeners here, So Kira Bell was someone who at the age of 16, or just under 16 actually, went to the Tavistock, absolutely convinced she wanted to transition. She thought she was a man. She thought that was the only way she would be happy. And we have these things of insistence, persistence, on consistence. And she kind of met all of those diagnostic criteria. She was certain. So she very quickly went through the system. She wasn't given a lot of psychological exploration and assessment. She had a really trouble. She's talked about this openly. She had a troubled childhood, separations, things she was dealing with, and her own mental health was not good at that time. But she was essentially affirmed, which is what the policy was then, and she was put on puberty blockers, and then she was put on testosterone within a matter of years. So she went at 16, and then by 18, she had started this transition physically, and she had a mastectomy, a double mastectomy, and really it was in her very early 20s, so literally within a matter of 2 or 3 years. From here, she just sort of suddenly realised that she was caught up in something, and it was to do with her mind, and that the physical changes she had made to her body were not really going to help her deal with the difficulties. And she felt she'd made a mistake. And the important thing is she felt the professionals at the Tavistock had helped her make that mistake. She was really so young and upset, and confused, and she needed someone to hold on to her and kind of stay with her and help her explore her feelings about herself and her whole identity.
Why do you think the professional in the Tavistock guides Kira to this way? What do you think? Especially because it was the problem that you do have that in your book. Yeah.
The problem is I didn't work in the service. I resigned as governor, but Sue did. But the problem is the patients come along, they're very insistent. They've got a fixed idea. This is the problem and this is the solution. And it's as if they say to the mental health professionals, look, you could help me remove all this pain and turbulence if only you would give me the concrete solution to my problems. Now, in mental health, we're used to people having concrete beliefs and ideas. Now, one doesn't argue with the patient. One's interested in understanding why they believe what they believe and what is behind, what's driving and motivating that belief. So you don't normally go along with the person, nor do you argue with them, but you're interested in, as Sue said, and as I said earlier, opening things out and exploring why such a fixed idea, and why do you believe that the solution to your psychological problems is in a concrete physical solution? Usually we don't go along with that in psychiatry.
And I think also, if I'm right, Raphael, you were getting at sort of how do the staff go along with it, and how do they sort of just agree to that? And that's a complex thing again. But what happened at the Tavistock was that I think staff over the years probably did have concerns, but you've got a problem again in other areas of mental health. My experience has always been, if I worked in an eating disorder unit, we'd be trying to think widely about why a patient was starving themselves, why they were so obsessed with being dangerously thin. And the staff were allowed to think openly and with honesty. They could give their impressions, they could talk about the family, they could talk about the experience of the child. That was sort of good psychiatry, trying to understand the child holistically. And I think my experience, even back then, and it got much worse as time has gone on, the pressures have got worse, but even back then, I found it quite uncomfortable if I tried to voice a concern that something was going too quickly. And certainly the staff more recently, and the Tavistock even made a statement, a public statement saying that their staff who'd expressed these concerns had negative views towards this issue. effectively accusing them of transphobia, really. And I don't think that's what the staff were doing. I think the staff were saying, we're actually letting these kids and the families down by this rush to something. This is not good psychiatric mental health practice. And I think the pressure, and again, we go back to the sociological question, you see, I think this is an area that is very difficult to think about honestly and openly. It's sort of driven by extremes and sort of really diverse views, but it's very difficult to find any space to think openly and honestly. I mean, that's what we try to do, but even we get accused of transphobia because we don't just fit in with saying, yes, we would affirm. We're also not saying, no, we wouldn't, support a patient if that's where they're going in their life. That's their choice as they become an adult. But we come back to this thing about children. Everyone, it's extraordinary to me how society forgets what it was like to be a teenager. The things we thought as kids and how we felt about ourselves. And we know, really, that as we get into our 20s, it changes, it mellows, certainly in our 30s. And but by the time we're old like us, you look back with all sorts of things and think, what was I thinking, But it's a really important part to remember that when you're dealing with these young children who are distressed, who it is so uncomfortable to be with if you're a parent. The parents just want something done. And obviously, as a clinician, if you're not solid and experienced and know how to hold on to your own mind, you'll get pressured into going along with it too. And then if the team, which is what happened in the senior team at Tavistock, according to reports, would put pressure on those junior staff, then everyone just goes along with it because you cannot be seen to be transphobic. And that's the issue you keep coming back to. If you don't go along with this, if you raise any kind of thoughtful concerns, you're transphobic.
See, both in terms of the patients, they're afraid of freedom of thought. The kids are often very restricted in their imagination and their range of capacity to think about themselves. But in the political ideology, it's the same. There's a sort of restriction of what's permissible. So you get this meeting of the patients who restrict thought and the ideology which restricts thought. And then the staff are sort of caught between the two pressures.
So there is a case in your book which I mentioned for Brazilians about, and a lot of people send message about the connection with autism or schizophrenia. There is a patient that you mentioned in your book, which he is very connected with his mother, and he tried to harm her. And later on, they referred him to transition. Could you talk about that, please?
Yeah, he was someone who had a serious mental illness. And at that time, this is a long time ago, at that time, the contraindications for referral for sexual reassignment surgery was if the individual had a serious psychiatric condition. But he suddenly got hold of this idea that his whole problem was not that he had a serious psychiatric condition, but that he was in the wrong, he was the wrong gender. And he went along to our national centre. He was over 18 and persuaded them that this was his problem. I wrote to them and said, look, because the whole basis of his thinking was problematic. He was fanatical about his idea that this was his problem and that was the solution. And it was as if he was going to get rid of certain difficult elements of himself surgically, and that would solve his problems. And I argued with the team, but they didn't. They weren't interested. They went ahead.
Okay. We about Abigail Schreier wrote that book, the famous book now here in Spain. In Brazil, they don't talk too much about the irreversible damage. When a girl or a boy made a surgery to remove or the penis or the mamas, the breast, sorry. Yeah, the breast. Which kind of impact, psychological impact, do you think they gonna have? Because in the last year, there is an article in the Economist, which the entire medical environment in USA, they was promoting the trans medicine, and the one trans doctor is a man who became a woman. He said he'll never refer the patient anymore for cross treatments because they didn't have enough material to make, example, phalloplasty or other surgery. Which kind of psychological problems the teenagers or people who pass for this situation they're gonna have it for you? Because, example, when I was kids, I didn't like my hair, and I shave it. Oh my God, I didn't like. Okay, but it's I gonna see my hair again because it's gonna grow up. But a breast will grow. The girl would have again.
It's complex, isn't it? Because if you were my patient, Rafa, and you said, I hate my hair, you see, what I would try to do if you were coming to see me is to try both to understand why it causes you such distress, but then to think about with you what it represents, what it makes you feel. Have you got some uncle you hate and his hair's just like that? These are all the things you'd explore. And it's not that you're trying to say, oh, that's the reason, but essentially, if we go back to the idea of kids, you see, if a girl is hating the idea of developing breasts, then there are all sorts of sort of below the surface, subconscious things connected with breasts. Were they breastfed? Did they witness their mother breastfeeding a baby brother who they hated, who they were jealous of? Do they kind of hate their own mothers? Do they want to attack the idea of their mother in them? Do they not want to be like their mother? There are so many ways in which getting rid of the breast represents something, but it's complex and it takes time. And it's not that you're trying to say, oh, that's what we'll blame. It's just you're trying to help the person come to see something about what it is they're hating in their identity. And they translate it into a physical thing. I think that's
what the other thing related to that other patient you were talking about is you're trying to assess how in touch with reality they are. See, one of the reasons that they didn't used to allow people who had a serious and enduring mental illness to have sexual reassignment surgery was because there was a worry that they would have an idea about what the surgery would do for them, and that would be different from the reality. Now, that sort of happens anyway. It's why we're advocating. Sue keeps saying we're not against all transition, but one's got to be clear that the whole thinking of the individual has been explored, because if they believe they can actually change their natal sex, that's a fiction. You can't. So that you can, make certain changes, but it's not going to take you all the way to create the individual you've got in your mind. So you've got to be ready for the fact that post-medical intervention, you're dealing with a gap between what I would ideally like to be and what I actually am. Now, some people are aware of that gap and they've taken that into consideration, and others aren't. You see, they feel they've been missold goods as a result of transition, and then they're living with themselves feeling they haven't been properly prepared for the results of medical intervention. And then they're dealing with a loss. So you don't want people feeling, well, this is a catastrophe. It's all been a terrible mistake. You want proper, thorough psychological evaluation.
Okay. Just about the connection with the autism. When I received a lot of message when in my social media when I mentioned about the autism, the connection with the autism, and it's always the same situation. I have a student example, and he's a trans. Oh yes, but why do you think about that? But I think because he has autism. I think I received around 50 messages in Brazil. From Brazil, they talk about this kind of things. Could you say something about that, about the connection with the autism, please?
Yes. So the first thing to say is, I think the diagnosis of autism has expanded hugely. I think when we were younger, it was only the most severe people, it was severe under autism that got diagnosed as autistic. Whereas now I think, there are many younger children being diagnosed. But really what you're looking at in those people who are sort of at that end of the spectrum, if on the spectrum at all, is they're kids who've got minds that sort of work in a certain way. And I think what you see clearly, and what people with autism would say, is that their minds often function in a somewhat different way to what many other people's experiences. So, for example, social situations are more anxiety provoking very often for people with those traits. A capacity to think more symbolically, to think, they tend to think more in sort of black and white terms. I don't know if you know this experiment with an empty tube of sweets. We call them Smarties here in the UK, but a psychologist has a tube of Smarties, you see, and it's empty, and they ask the kid what's in there, and then they tip that out. They see them put in a pencil. But the child who can't think more sort of widely would still say, I think there's Smarties in there. Do you see what I mean? They can't see that they can't kind of put those two. Sorry, that's not a very good example, maybe. You might want to edit that out. But I think it's important because with the kids that come, often when they say, well, I hate my body, I'm uncomfortable. But when you say, okay, let's think about that. Can you tell me what's uncomfortable? And they have a very kind of blank moment. They can't really access their feelings around that or think very widely around it. It's just, this is uncomfortable, therefore I want to get rid of it. Do you see what I mean? It's like that sort of very concrete move.
Yeah.
And it's really important to understand then that children who've got that tendency, that trait to think more in that way, will also be very susceptible to the ideas of, I don't feel right. This tells me I'm going to feel right. Okay, I'm going to do that because it tells me I'm going to feel right. Do you see what I mean? It's kind of like a...
So the ideology, which gets rid of complexity and adopts a certain position, fits with the individual psychological presentation. That's what Sue's saying. You get rid of complex conflicts, anxieties, you get rid of all that, and you can go for a very narrow preoccupation with your gender.
And okay. I was going to say...
Yeah.
Go on.
Yeah, go through, please.
No, it's okay. I think that we'll come back to it. But I think what I was just going to say is there's a difficulty of interviewing us both together. Is just also to say that the issues around adolescence. You see, if parents of children with a sort of slightly more severe autism would tell you they hate change. They absolutely, if you move their toy to the wrong shelf in the bedroom, it's not right, and So if you imagine that at the lower end of the spectrum, many of these kids will struggle with change and social anxiety. So again, you come to adolescent years, and in understanding Abigail Schreier's sort of observation about this swathe of teenage girls, that maybe they're people who kind of managed things as children. They've kind of camouflaged their deficits or just played, and someone said, oh, they're a kooky kid, they just, but as they get into their adolescent years, that is so difficult. The change in their body is very difficult to cope with. So it gets expressed in the physical as well as the social anxiety. Sorry.
Don't worry. You are helping me a lot. Let me I have a doubt example. That is I'm almost finished. I'm sorry, but example, they are giving puberty block for 8 years old kids as an example. We don't have the brain really developed about in the full picture. I mean, is that right to say the kids who are taking this puberty block, they will never have the brain really developed?
One of the problems of this whole area with the sort of political interference that Sue's talking about is there's been a complete shutdown in not only as Sue's talking about the usual debate and discussion, there's also been a shutdown of research, the research that should be surrounding this area, so that people are worried about the effects of puberty blockers on bone marrow development, on sexual characteristic development, but there really is a lack of research. And the problem has been that people have been scared away from doing the research. The fact is, you're not going to pump an ordinarily developing kid full of puberty blockers, which are going to stop the ordinary physiological development, and think there won't be consequences. There are going to be consequences, physiological, sociological, and psychological consequences. The problem is we don't know exactly what they are.
Mm-hmm.
I think there's also a really important thing for your listeners or viewers to know as well. You may have heard of WPATH, WPATH, the World Authority, allegedly. I think it's really important because it gets used again and again that people say, oh, the WPATH guidelines, as if somehow they are a world authority. I have to be clear. We spoke recently with Dr. Stephen Levine, who's a hugely eminent doctor and has worked in this area of medicine all his professional life. And what he used to be part of a WPATH several years ago, when it was a thoughtful, think tank, which wanted to learn about anything new. And obviously they were concentrating in gender and sexology and so on. But what he said happened was that it gradually got taken over by a certain political part of the organization, and that people like him were no longer welcome because, of course, he had huge experience and expressed certain doubts about the way it was going. And really, they just got partitioned and, pushed away. And now even when they have their conferences, I've heard from clinicians in America that they find it difficult to even go and express opinion. They sort of edit other views out. So everyone thinks they're the world authority and they're experts. But actually, the evidence, the research they've based this stuff on now, there is developing new research that has looked at that. And there's an organization called SEGM, SEGM, Society for Evidence-Based Gender Medicine, who specialize in this. And they examine exactly what is going on in those studies. And of course, what you find is that many of them are sort of just very subjective opinions from people, or they're taken from a certain selected group of people, or the cohort of patients is too small. So it's not gold standard research. And yet worldwide, the world has started to base and quote and say, we're following these guidelines. And it's a trick of the hand, really. I just really feel it's important to say that.
We got to stop, Raphael. But one of the good things that the government did here after Sue and Kira Bell took the case,
The judicial
review, was that the government brought in the ex-president of the Royal College of Paediatricians, a woman called Hilary Cass, who had no skin in the game, as they say. And what she did was look at, as Sue's saying, the sort of where are we with the evidence and the quality of the evidence. And her conclusion was that there isn't enough evidence to justify these current approaches. Now, that means something that Sue and David Taylor said in 2005, and David Bell and I backed him in 2019. But the game changer was, in a way, she was brought in by the government to have a look. And she said, there isn't enough evidence to justify what we're doing.
And I think it's important as well to say is, in a way, many people claim they're gender experts, but I think the more you learn about this, the more I think we just don't know. And again, that's in a sense where we come. The idea of first do no harm is we think it's important to try and understand this, and that's the least harmful position to take. Now, some other people might argue with that, but I think that is where Hilary Cass and her review have got to. That until we get much more evidence in this, proper evidence, gold standard research, we really shouldn't be unfolding this clinical treatment as it has been this past few years.
We're going to have to stop, Raphael. I'm sorry.
Don't worry. Yeah, if you want to say something to final word for us, please be.
Read the book.
Read our book. No, I think, look, what I would say is curiosity. The children need to be encouraged to have curiosity about themselves. And as clinicians and professionals, we need to have curiosity to learn more, because we need to improve the care of this group of patients, for sure.
Thank you very much for the opportunity to talk with you again. I feel both you in my book. And my book is not talk about the clinical situation, but the philosophy, geopolitical situation, which drag people for this madness. For me, this is madness. I'm very worried. No, I'm not transphobic. I'm not against LGBTQ and plus, but I'm trying to help them. I'm trying to help them, and you are helping me with that. Thank you very much.
Good luck with your book.
Thank you.
Thanks a lot.
Okay.
Thank you.
Raphael.
Bye.
Bye.